I'm Dr. Jacqueline Cheung. I'm a psychiatrist from the Philippines, and I practice in a city called Cebu. In the public, when I used to work in the hospital, definitely it was schizophrenia and the psychotic disorders, right? But now, when I transitioned into the private, I noticed that there are also a lot of cases of depression and anxiety. So I guess these are the top two, right? So I guess the depression is the leading cause of disability worldwide. It's a major contributor of morbidity and global burden illness. And I guess followed closely by the anxiety disorders. There are a lot of anxiety like phobia, panic disorder, generalized anxiety. So I guess these would be the top three. Personally, I would say there is an increased reporting of these symptoms, also due to increased awareness. Ever since the pandemic started, there has been a sort of boom in mental health awareness. I guess everyone was so stressed, and then we all just wanted to help each other stay on top of her mental health. And there has also been an increase in health seeking behavior. So a lot of people choose to go and have consultations, whereas before they could choose to just bear it for a little bit, right? Unfortunately, there is still the stigma. But on the bright side, there is a growing awareness of mental health and well-being. So we see this more from the teenagers, 20s to 30s age group. We're very assertive in seeking professional help, and I really appreciate that from them. Sometimes they're also the ones who are teaching the older generation that it's okay to not be okay. And, seeking help doesn't always mean that we're crazy or that we have like some unsolvable problem. No. And since the pandemic started, I've noticed that there have been many organizations also being open already and promoting mental wellness. Like just before we get to the part where our symptoms are severe enough to become a disorder, it's also to promote mental wellness to kind of prevent all the bad negative stress from happening, right? So there is also an increasing awareness or increasing knowledge on mental health topics like depression, anxiety, stress, and also a lot of people advocating for mental health care. So despite the old stigma that's still kind of ongoing, there are these new seeds that are sprouting. So I hope to see them, grow in the next few years. That was like a really drastic change that everyone had to suddenly stay at home. So, the children, the students, of course, they miss the chance to interact and socialize with their peers. For some, this is the most exciting thing about going to school, and now they're just stuck at home. So they feel very deprived, and it makes them feel sad. And young people, they also have this fear of missing out. They feel anxious because they can't gauge their performance with their classmates. They find it difficult to tell whether they are at par or lagging behind. They feel also a lack of validation in their struggle, so it adds to feeling nervous and anxious. So all of these difficult emotions on top of the uncertainties and drastic change can definitely take a toll on mental health. They report, I guess there will be increased reports in feeling depressed and feeling anxious. And for the parents or working people, I believe it's also difficult for them to adjust. Their children, like maybe toddlers, might cling to them or be fond that they're always present at home. So it might cause for them to be distracted at work. So it's difficult to separate the work and the home situation. Because before, like when we went to work, we're the working person or the working people. And while we're at home, we're the at-home person. So those can be two very different people. So now, because of the closure of the schools and offices, like the two roles seem to have merged, right? And no one was prepared for this sudden role change. So that can also cause a lot of stress and burnout for them. And I guess for those people who have a small living space, or maybe pre-pandemic, they were always out of the house, So a whole family adjusting to living together in a small space can maybe also be stressful. So like even if there are harmonious relationships between everyone, if it's something new, it will definitely require some adjustment. Well, it's hard, really, for all of us, like including me. So, because if there's a lockdown, there's a closure of malls, closure of the stores, no restaurant, no salon. So the employees who do not report to work may not be compensated. So, and on the other end, there's very limited public transportation. So for those who do need to report to work, like they have to get early, schedule their trips, or make commuting arrangements. For the stores, there's very limited transport of goods or supplies. So, for essential services, there's a high demand for them to provide. So this huge financial and economic burden on top of the health crisis. So can you imagine the amount of stress that can bring? And so it's difficult because things can also be so unpredictable. Like next week, there's going to be a lockdown again. It's difficult to find calm or feel grounded, in these very ever-changing situations. So yeah, in summary, I guess it's very hard for all of us. But we've almost been 2 years into the pandemic. People have found ways to cope. However, it's still not ideal. I guess, of course, we wish for all of this to be over so that at least we can breathe easily and comfortably. Well, generally, first you have to get acquainted with our stressors, like identify the exact things that are causing all of these problems in our life, and then maybe address one problem at a time. Not all of them all at once. That would be very hard. So by addressing one problem at a time, we kind of build our problem-solving skills, and along the way, learn effective coping strategies like how to deal with this issue if it arises, and slowly letting go of unhealthy coping mechanisms. So along the way, it's also important to find things that work for us, stick with them. If something does not work, we have the liberty to adjust it, to improve it, such that it will work good for us. So it's also about exploring and discovering a little bit of trial and error, and along the way, like getting to know ourselves a little bit better. Seek help when we need it. Seek support from our family, our friends, support groups. So you might not be able to do this on your own, and that's perfectly okay. As humans, we were never really built to be independent. Rather, we were created to be part of a community. So it's good also that you use the word build mental resilience, because that's pretty much what you need to do, right? Buildings don't come manufactured as a building. We also have to build it from the ground up, make a strong foundation, choose the good materials that work for the different kinds of situations, until over time we can create or we can build that big building that we were dreaming of. So in a way, maybe that's a good metaphor that we can apply also in building our own mental resilience.
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.